Hello and welcome. Today I have a special guest, Dr. Della Mae Chadwick, who is actually my first guest on the podcast. So even though this is episode 19, because that's in the order I uploaded it, this was my first podcast. It wasn't as organized as I would have liked to have been, and I didn't have the screen formatting right, but I figured we still talked, had a good conversation. I want to get this up here now, and I will invite her back as I edit this and take notes. I will come up with deeper questions. I want to dig deeper. She responded because I just posted something about is anybody interested in exploring the psyche and holistic health? And she responded because that's right up her alley. She's an acupuncturist studying Chinese medicine, and there's so much there. And she admits that there's so much more for her to learn and discuss, but she has a wealth of knowledge that she's willing to share. So let's get to that. And I hope to have her back and dig much deeper. Thank you. And all right, Dr. Della Mae Chadwick, thank you for joining me. I really appreciate it. Would you like to give a little introduction about yourself, please?
I'm Della Mae, Dr. Della Mae Chadwick, and I have been a personal trainer for 27 years and a massage therapist for 20. I got my master's in Oriental medicine probably 12 years ago, and a few years ago, I got my doctorate in acupuncture and Chinese medicine. So yeah, that's me.
Okay. Well, well, excellent. I'm interested in life stories, kind of what makes people choose their paths. Now, of course, there's a lot to talk about there, so I'll try to actually ask you specifically. Let's focus on from an aspect of health. I know we've crossed paths in the past, martial arts and fitness. So kind of just tell me your background as far as getting into personal training, that progress from health.
Yeah. Well, when I was younger, my dad was really sick and he kept getting sicker and sicker. And I knew that had he taken care of his health and exercise and eaten better, he wouldn't have been in the situation that he was in, or at least would have delayed it anyway.
Mm.
And so that part did motivate me to go into like this nutrition focus and supplement focus and working out a lot. I
Yeah.
did run track in junior high and high school, so it's 6 years of track and then a year in college, then also cross country for 4 years. So and working out for 4 years. So I've been working out for 34 years.
Yeah. Yeah.
So I've been really health focused, and my dad got very sick when I was like 19, and within 2 years, I was working out quite a bit, and I worked with a trainer, and he was a professional football player, and he really inspired me to become a personal trainer. And within 6 months, I became a trainer, and I loved it. I knew that had my dad had a trainer, it would
Yeah.
have made a really big difference. So I definitely enjoyed and have enjoyed and continue to enjoy uplifting people and getting them to make a commitment to caring for themselves. I know that making it's such a big commitment for a lot of people. There's a lot of barriers for them, but I support them through it the best I can. I mean, it takes two to tango. I'm committed to their health.
Yeah.
But also, when I was 21 years old, soon after becoming a trainer, I got into a car accident. I was going to get my degree in art, and that was a quick pivot. As soon as I got into that car accident, I started getting massage. I I started taking care of my health in a different way. I'd never done acupuncture before. And when I was coming back from massage therapy appointment, I was driving through a particular town. I looked up on the building, and there was a 5 element theory acupuncture sign.
Yeah.
And I was like, I was really struck. I was overcome. And I was like, that's it. I had never had acupuncture before. And I said, that's it. That's what I'm supposed to do. So
So
within a week,
yeah.
I made an appointment. So,
Uh, if I can stop you, I mean that you must have had some knowledge I mean, you saw it and you were drawn to it, but you must have had some background knowledge prior to that, right? Or
Yeah, and that's what I was just about to
okay.
share, is that prior to that, probably junior high, but definitely in high school, my aunt used to come and stay with us like 1 day per week, and she would go to work. She would always go see her acupuncturist and
Okay.
then come and stay. And so she would always talk to me about acupuncture, and I was always intrigued. And I always had a lot of questions for her. And I remember something on National Geographic. I think there was like a picture of a whole bunch of acupuncture needles on the face or something like that. And I read, she's like, you have to read this article. And I read it. So she was already, putting it into my head. And then when that happened, is I was just overcome. I know it roots back to my Aunt Rhoda. So
Yeah. So when when you're when you're treating someone, what kind of people are coming? Do they have specific conditions? Are you what type of people come to you? What do they usually?
that's a really good question. People do come to me with problems, and what I've learned in Chinese medicine is that once you have a problem, like it's hard or harder to kind of backtrack. And like if someone's had something for 5 years, like lower back pain, there's only so much that you can do. I have encountered patients that I do a treatment and immediately they're like, I don't know what you did, but do it again. Like I feel so much better. And, like they improved by like 80%. So I like to think of this as that magic can happen at any time and you never know. And it could take, weekly acupuncture treatments for 2 years to really get in there and unravel the damage, but maybe not. Maybe if there's slip disc or something serious, significant, then it's harder. But to answer your question is that I find that people that I'm drawn to and that are drawn to me are people who have emotional, mental, psychiatric issues. And so that has always been my passion. I have found that in Chinese medicine, it's like it's rooted in emotional imbalance. It's the emotions that can upset the system. And, you come in with acupuncture and herbs. There's a lot more to Chinese medicine and acupuncture. A lot of people think, oh, licensed acupuncturist needles. And with Chinese medicine, like I tell people, it's like, oh, I'm afraid of needles. No way. I'm like, well, don't get needles when you go see your acupuncturist. And they're like baffled. I don't understand that. It's
Yeah.
like, there's so much more to Chinese medicine. So I have found specifically with psychiatric, mental, emotional stuff, is, the acupuncture is like icing on the cake, but where it's at, and what I think is meditation, qigong, and herbs. Herbs are like immediately impactful. They're the most impactful thing that I encountered. So once I got into Chinese medicine, I thought it was all acupuncture and that's it.
Sure.
By the end of my Oriental medicine degree, I was like, herbs, like kind of forget acupuncture. It's
Okay.
herbs and nutrition. So yeah.
Okay. Yeah, I was gonna ask you about that as far as like I mean, I guess I do think of anything, yeah, Chinese medicine or just like more of a holistic health, that there is a balance that I imagine, yeah. I mean, you mentioned nutrition, so diet, some sort of stress relief management or exercise. Are these things that you are, I mean, of course you have the personal training background too. Are you able to give someone a whole package, or are you usually requiring them or suggesting that they go somewhere else for some of these things, or you're able to kind of give them the full?
I do make recommendations. What I find is that when they have their barriers, psychiatric, whatever, their trauma, it's usually I'm dealing with PTSD.
Okay.
And acupuncture, it's been proven to be profound in the results with veterans and other PTSD patients. So that's usually what I'm dealing with is PTSD. And I always recommend my hypnotherapist. I'm constantly sending, like, he's taking care of so many people, like friends and
Yeah.
patients and
Yeah.
personal training clients. Like I even had to tell one personal training client, I'm like, I can't work with you anymore. You need to go see the hypnotherapist. We're not getting anywhere. It's your
I-
barrier is just too
yeah.
big.
you still provide or completely, or just at the same time, he also needs that, or
Well, because I said it.
yeah, yeah.
I was like, you gotta, he immediately contacted him, and
Okay.
within 2 sessions, he was like, yeah, with nutrition. He was so excited about his
Oh,
workout.
nice. Yeah.
Everything changed.
Okay. So I'm also interested in getting back to really kind of what I'm doing and looking at, like, life and our choices. I kind of want to know about, obviously this was the reason you started, you saw, you saw your father, and you had these reasons to help. I mean, there I always obviously see this, there's compassion, giving, but what about yourself? How have you I mean, obviously you learn about the body so you can apply it to yourself, but like really what, how, or I mean, I guess first, I'm assuming that it has benefited you, so I'm jumping the gun and gonna ask how, or it could be opposite. I mean, I do know some healers that are actually like, they can, it drains them. So I guess there's both aspects of it. How, tell me more about, like, you, how this has changed you and your lifestyle and your health.
Well, I think it's multifaceted, and I'll start where first with taking care of others, and that what you were talking about the energy drain and that sort of thing. I learned very early on techniques in order to pull energy in through me and out, and not absorb their energy. And I found that, like, yeah, some of the best healers, like, impact on others, those kinds of healers, they're the ones who get sick. They're the ones who get cancer. They're the ones who die. Like, one of my friends, well, actually a client, someone I take care of, he was seeing a massage therapist for 25 years every single week, and then he died at age 57 of cancer. And it's like, well, I know why. He
Yeah.
was absorbing the energy. So I go to great lengths in order to take care of myself, in order, like, if I'm feeling like emotionally, like, spiritually weak, I know that I have to do extra measures in order to take care of myself and take extra time, or like not do as many treatments. So I go to great lengths, and that started in my master's degree with learning Qigong. So
Okay.
Qigong is where it's at for me. And how this has also impacted my life is I've been able to work through a lot of stuff with acupuncture and hypnosis too. So I have relied heavily on hypnosis, going in there with the subconscious mind and changing faulty belief systems, so that I can better take care of my health and keep my center in caring for others. So I think that answers your
Yeah,
question.
well, let me follow up a little bit with, I mean, have you ever been, for whatever reason in your own life, that you were unable, or you felt like you would be unable to provide the right care, that you'd have to cancel somebody based on,
Yes.
like, just, or even like not like you called in and you knew that you would, but like actually be there on, and just, even though you don't want to do it, and just like, I can't do it right now, and like,
Yes. So I was just talking about it yesterday, and talking about, it was a good conversation about self-care. And I was doing a treatment, I think at that point it was massage. Um, and I'm in preparation for doing the same thing to the same person in same or similar situation this upcoming weekend. So I have to like get my head straight and make sure that I'm clear on how it is that I need to handle situations. But I was really proud of myself. In the past, had I had this, I'll touch on it in a moment. Had I had this not good situation in the past, I would have pushed through it, and I would have, like,
right.
massaged and touched someone just because I had to.
Yeah.
But what I did last time was I stopped and I took care of myself, and I asked for what I needed. There was someone in the room that was distracting me,
Okay.
talking loudly, and I'm trying to focus.
Yeah.
And I asked for what I needed, and I wasn't going to get. This person said no. So I stopped. I washed my hands. I put everything away, pulled the covers over the patient, and just let them rest. So I was really proud of myself that like I didn't get upset or anything like that. I just needed to take care of myself and take care of him, because I don't want to give crappy treatment because I have this feeling or anxiety or frustration that this person is talking, or whatever my distraction was and my emotional reaction to the distraction. I don't want to give that. So like I can't touch someone's body when I'm feeling that. So
Sure. So I'd love to hear if you have a technique that you could share to, I mean, what sort of is there a qigong trick? I mean, a breathing technique or any like, I mean, I know it's so deep, but if there's any just like go-to short, obviously it's not going to be the you know, the big deal, but you have any advice
the
for
quick fix for other
yeah.
people. I've done so much meditation
Yeah.
and qigong in my life, and really being connected to my body, like even working out. It's a meditation. I'm focusing my inhale, exhale movement being in my body. It is a meditation, and it's always been a meditation. I didn't realize it until I was about 21. I had been working out for 7 years at that point, but I didn't realize it until then. And then I just really embraced that exercise and the repetitions and the breath work, that it is a meditation. So in that moment, what I was just talking about this last night. I'm so glad that you're asking this question. It just like reaffirms it prior to what's happening this weekend. That really being in touch with it's like my gut, my intuition, my spirit, that power that's within me, being really connected to that and not disconnecting for the sake of someone else's benefit and their ego and their attitude and their projections, whatever it is. But for me, remaining connected to my power. And by maintaining that connection, then I could feel like I have a visceral experience. I'm sure some people like they hear something in their head or whatever, but for me, it's visceral. I can feel it in my chest and in my stomach. And when the feeling is strong and I'm connected to it, then I know I have to do something. Like that's it. I have to ask for what I need. And if I'm not going to get what I need, then I need to make changes. And that's just the way it is.
Yeah.
So
Okay. Well, no, that's actually, I mean, that's uh that explains the, I mean, a lot of the hardship that comes with it. So I guess is there an area where, I mean, I imagine there's like personal growth that benefited you, that beyond just the, you know, of course it feels good to help people, but is there I mean, are you able to project chi in a way that you wouldn't, I mean, be able to, like what kind of things can you do now because of that your training and practicing it so much, like what kind of yeah, that makes sense. Yeah.
like what kind of
I,
techniques I use?
what's that?
Like what kind of techniques I
I,
use?
I guess what generally, I guess, for like 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 just looking at your life, like kind of like spiritual well-being type like are you stronger in some area, whether it's psychologically or I mean, because you mentioned it, I mean, a lot of these things, that how to prevent it draining you. Are there any areas that are just intrinsically beneficial, where you're able to, maybe by, you know, understanding the body, that you're in more touch with your own body, or something, some sort of
Yeah.
insight that you have that somebody wouldn't have if they hadn't
Done the work that I've
yeah,
done or have the
yeah,
knowledge. Yes, I think that really my whole journey with Chinese medicine, and understanding, I mean, I definitely don't have a mastery of it all. I'm going to spend the rest of my life studying this. Is like, it's so vast. I had no idea what I was getting myself into when I stepped into Chinese medicine. I was like, once I got in there, I went, I was like,
yeah,
okay, finish. It'll be good in the end. Things will work out in the end. But through that journey, learning how the body systems are according to Chinese medicine, and having an understanding of the emotions that are tied to what things might be out of balance. And knowing the solution, I was actually just talking about it right before our call here, is the person is challenged with addiction. And I said, do you know what the solution is for addiction in Chinese medicine? He said, no. I said, it's creativity. Because he's like so excited. He's been
Yeah.
so creative in the last month. And that's the solution in Chinese medicine for what's called a liver imbalance. And he's struggling with addiction, alcoholism, and it affects the liver. So it's such a great solution. And I also added and compassion.
Yeah. Yeah.
So creativity and compassion. So
Yeah.
yeah.
Okay. That's so as far as you know, I have, yeah, I have, I mean, obviously I'm here in Thailand, and there are some there are Thai actually has a similar they have herbs, like they have Thai herbs that are specific to Thailand, and then but there's a lot of Chinese influence in some places. I have been to an acupuncturist once, or I mean, I've been to a couple times, but I've only been to one specific person, and he used there were needles, and they were also electrified, which was interesting. I didn't know, and I imagine that wouldn't be traditional, but it's effective. What do you use those, or do you have thoughts about them if they're better?
I do. And to touch upon what you were saying about the Thai having something similar, there's a reason why it's a master's in Oriental medicine. So having it come from China and, come to Japan, and then Japan developing their own, Japanese scalp acupuncture, and like doing hara diagnosis in the abdomen. They have their own style. The Koreans have hand acupuncture, and the French have auricular acupuncture. So it's like everyone has their, well, I shouldn't say everyone, but some have their little niche. So with regard to e-stem, that's what it's called, where you put the little clipper things, and then it does the electrical impulse. Thank God they were developed, probably within the last 100 years or whatever. Because the technique before was turning it very, very quickly for 200 turns. So it simulates that, and it makes it easier on the I know I can't move that fast. I tried when I was learning initially. I'm like, I can't do 200 of these. My fingers don't move that fast. So when you do the little things, and it does the electrical impulse, and there's so many different variations. Like it could be rapid, it can be intermittent, it can be low. So, and those have different effects. They're really, really powerful, especially for pain. Yeah.
Okay.
Does that answer your question about?
Yeah, no, absolutely, it does. And I guess I think there, for some people, there would be a conflict between like Eastern and Western, or like allopathic treatment. I mean, do you have general thoughts about that, or do you get people who I mean, how do you approach it? Somebody that maybe is skeptical, but you can feel that they're what type of how do you make somebody feel comfortable who I mean, they're there, they've come and seen you, so they're not, I'm not talking about just an outright skeptic that doesn't even want, I mean, somebody that's obviously, somebody maybe talked them into going, but you can feel that they're not comfortable,
they're not bought in,
fully, but they're there, so you feel like, okay, you can win them over. How do you? And let's say like they, maybe they're used to their pills and stuff, and I'm assuming you want to just how do you make somebody comfortable?
Well,
Yeah.
I talk about integrative medicine. I went to an acupuncture and integrative medicine college in Berkeley. And there is a lot of discussion and instruction about integrative care and working with Western medicine doctors. In China, all doctors are trained in acupuncture. They
Oh,
work
okay.
synergistically.
Okay,
That's what I've been
you
taught.
recommend. Okay, yeah,
So they work synergistically. There is no just
sure.
Western medicine in China. I mean, there was a period of time where it was like banned and that sort of thing. So
Yeah,
so it went underground.
yeah,
Barefoot acupuncturists out in the villages, and then
yeah,
it came back. So, but what I do, like with someone who's skeptical and they're like really attached to the Western medicine, well, first things first, I say, Western medicine has its place, and I do integrative care. And then they'll describe what's going on, and I'll say, you need to go to get an MRI, or you need to go to your primary, and you need to ask for this, this, this. You need to explain to them what's going on so that you can I believe you get really clear on what's going on, what the problem is, so that you can apply the correct treatment. If you don't know really what's wrong, you could sit there and treat and treat and treat and not get anywhere.
yeah,
Maybe there's something structural going on, and it's a really big deal, and you're like not really making that much headway because you didn't get a clear Western medicine diagnosis. And of course, there's a diagnosis in Chinese medicine, and you do treatment based on that diagnosis. But for me, they work synergistically. You can't just have, well, I don't believe you can just have one. And for my clients that say they're on like 5 different medications, I
yeah,
just start to focus first, because way that I believe Chinese medicine should be approached is number 1, nutrition.
yeah,
Number 2, Chinese herbs. And then, the acupuncture is, like I said it earlier, the icing on the cake.
yeah,
But those two, and then Qigong and meditation, and getting things like settled, because the emotions really upset things, I believe. And so with Western medicine, I always hear, oh, I'm on, I'm taking gummies. My doctor prescribed this, and I'm doing this for anxiety. I'm taking that to fall asleep. And, it's okay in the beginning, but then as you work with someone, maybe it'll take a year to go, oh, I don't really need that medication anymore. Now I'm
yeah,
taking this herb in order to fall asleep, or
sure.
herbal formula, I should say. So yeah, I believe in integrative care, and I believe that's very important to work with Western medicine doctors. And unfortunately, that a lot of Western medicine doctors that I've communicated with, they know nothing about Chinese medicine. They
Yeah,
think it's like, oh, that doesn't work.
yeah, yeah,
And there was one particular doctor, and he was an MD, not just like a
yeah,
PhD. I was like, do you know anything? Because he already made up his mind about Chinese medicine. So
yeah,
like kind of like a contempt prior to investigation. It's like,
yeah,
well, if you haven't done the research, do you know how much research that is out there? Like how many case studies that have proven the efficacy specifically of acupuncture? They focus on acupuncture. He had no idea.
yeah,
And it's so important for acupuncturists to be able to have a direct line of communication with the Western medicine doctors. They need to be on board so that it's working, you work synergistically and
yeah,
together as a team. I believe in having a team, not just one
absolutely.
approach. Yeah.
I mean, I'm really, yeah, when it comes to like the they're if they're taking pharmaceuticals, I mean, and that can be a big problem if you're all, I mean, because herbs are powerful and they shouldn't be taken. In that case, integrative could be bad. I mean, well, if you're working together, but I'm thinking, what if that person or is also, maybe they're not telling you, but they're taking them because they like them, and if they're doing both, it could cause some serious
Yes.
problems. And
Yes.
how do you think people are lie to you and are taking stuff, or how do you go about making sure if they are taking their pills, you just don't give them herbs or
Well, every client and patient that I've had, they really have a deep regard for me and trust, and they know that they need to be fully open. And of course, there's things like the subconscious mind, like having the barriers and those
yeah,
faulty belief systems, but they know that, one, I'm safe,
yeah,
and they know that I can benefit them. So I've found that they're very open.
Good.
And it's very important for herbalists or Chinese medicine doctors to know what the client is on, because there are conditions where you can't take certain herbs and formulas because the herbs are inside the formulas. You cannot. There's like a toxicity. You can't.
Yeah.
So there has to be the knowledge. So my hope is that anyone who's going to an acupuncturist understands that they need to be fully honest. They need to expose everything in that intake. They need to share everything. They need to remember, like maybe before the appointment, writing down all the medications and that sort of thing. So doing a really proper intake, because there are going to be patients that they forget. They forget that, oh, I didn't tell you about that condition, that medication. It's like, whoa, I didn't know that. But what I found to be true is that they are open.
Okay, well, yeah, that's good. That's so yeah, I have one more question. It goes back. It's I mean it's off topic, but to me it's the most. It's become kind of my passion. This is what my research was on, and it's looking at our own mortality. So like, I guess the question in short is do you have an ideal way that have you looked at death and think like, this is how I want to die? Do you have a that, like, is there a preferred death that you can name offhand?
Preferred?
Yeah.
Well, I certainly wouldn't want to drown or be burned to death. So, but I don't care, when it's my time to go. Like when I was 6 years old, my sister was killed by a drunk driver in a car accident. So it was at 6 years old, in my formative years, that I got an understanding, like I could only live to 22. I'm like, just because some people live to 50, 60, whatever, but I just really trust in that process. Like this is my belief, that I'm here for a probationary period to learn the lessons that I need to learn, and then I'll just go to the next life.
Sure.
So, and hopefully it's not like a terrible, like, so to answer your question, I prefer that's a more peaceful transition.
Yeah, for sure. Yeah, I think yeah, there's definitely, it's easy to I think identify some unpreferred ways of death. I guess that question will lead into my next question, which I mean, because for me, I've noticed that like I kind of live my life in a way that I have a preferred death, which it's peaceful, pain-free. I actually want to consciously kind of know. I don't want to just go to sleep and not know, but I think even if you were in your sleep, you'd kind of know. So, but yeah, it would be a shame to be, a horrific accident where you're killed suddenly, I think. But even then, I think time stops. You probably would, I think you're going to experience something no matter what. But I guess my life, I look at like my life kind of, I want to be on track. One of the big things in my research I found is just like, there's so many people that they don't want to die in hospitals, yet so many people do die in hospitals. And it's mostly because of the way that they look at health, and they look at it as they need some authority. Obviously, I think Chinese medicine would be a better way to provide somebody with that peaceful death that they want, rather than, submitting to letting the medical establishment kind of, take care of us in the end, when it's almost assuring that you'd be in a hospital. But I guess so. So I'm always kind of adjusting my life and saying, okay, am I going in that direction? So I guess in a way, if that's not the way you look at it necessarily, but still you're looking at moving forward in some way, what's next?
Well, my higher purpose is my driver, my why. I believe that I'm here to, facilitate deep, incredible healing and catalyze positive change. And I know I need to be the most powerful woman and healer that I could possibly be, which means I have to take care of myself first. Before I have to say no and take care of myself first, before I can actualize that and serve my higher purpose. But when I really got that I'm here to serve, like that's my driver, like I can't quit because I'm here to serve. I need to, serve as long as I can. I have joked that, I'll probably die like sticking a needle in someone. And hopefully I don't
Yeah.
kill them. It's like not
Yeah.
right into the lung or something.
Yeah.
So, um, but I've also joked that like I'm probably going to hit my head on a cabinet that way as many times as I've hit my head.
Oh,
So, yeah. So my driver, my why is serving my higher purpose, and really, it's like I've already affected change in like thousands of people's lives. How
sure.
many more thousands can I affect?
Yeah.
I mean, I might only live one more year, but I'm still going to focus on being connected with my higher purpose.
Okay. Absolutely nice. Um, all right. Um, yeah, thanks for talking with me. I look forward to maybe in the future doing something again and even getting deeper. And I think, and I know you're, like you said, it's a lifelong learning experience, and you'll never learn it all. I'm very interested in it, and so I hope as you learn more, and maybe I can have some deeper questions. We can go deeper. I'm definitely I definitely believe in what you're doing, and
Thank you.
I look forward to hearing more and doing some of my own exploration, and then I'll have more knowledge that I'll know the right questions to really ask about some like qigong. I've only touched up on some of it, and that's something that uh, I'd like to learn more about. So I hope to explore that next time. Thank you.
Okay.
All right.
Okay. All right.
Bye.
Bye.
Goodbye.